Justin Price, and I'm the creator of the BIoMechanics Method, which provides corrective exercise education for health and fitness professionals. This is the third video in our 6-part series on understanding some of the common causes of lower back pain. In this video, we're going to start to talk about some of the anatomy that is affected by the common deviations we learned in videos 1 and 2. So this video, we look at the anatomy of the lower body and how disruption or dysfunction of some of the muscles can affect the lower back. Now you remember from the first video that one of the most common causes of lower back pain is overpronation. So when you overpronate, the foot collapses and the arch of the foot flattens out. The muscle that actually holds up that medial longitudinal arch, so this arch right here on the inside of the foot, is called your flexor hallucis longus. And that's a muscle that actually, if you push down, creates tension in the arch. That muscle comes from just behind the big toe, runs all the way up and up the calf. So when you go to walk, it's the tension in that muscle that helps slow down the arch and stop the foot from collapsing. Now we learned in traditional anatomy that that muscle actually does this. It actually brings the toe down like that, so it creates an arch. However, you don't walk like that. What happens is that arch should slowly dissipate tension, but it shouldn't collapse. And the way it does that, it doesn't do it by contracting and bringing the toes under. It does it by getting tension in it and allowing the arch to decelerate at the right rate so the foot doesn't collapse. Because if the foot collapses, remember, the ankle rolls in, the knee rolls in, and all the stress versus being dissipated by the muscles gets transferred to the joints, and you get joint pain and disruption all the way up to the lower back. So we know that this big toe muscle needs to lengthen effectively under load to decelerate stress to the foot. If we look at the Tibialis Anterior, that's a muscle that comes from the outside of the shin, wraps all the way down across the front of the ankle, and also inserts behind the big toe. So traditional anatomy tells us that the Tibialis Anterior brings the foot up and and supinates the foot, so it turns the big toe up and in towards the belly button. Once again, you don't walk like this. What happens is the foot needs to transfer weight and slowly enable you to accept weight over the foot. So that muscle actually, if you think about it, is a really good stirrup in holding up the arch of the foot as well. So it needs to lengthen correctly like a rubber band to help decelerate the foot as it pronates. So you've got flexor hallucis longus and tibialis anterior that need to function correctly to stop the foot pronating, which will stop the knee smashing in towards the midline, stop the pelvis collapsing and getting the stress to the lower back. If we follow up this chain of muscles, the IT band comes from just on the outside of the lower leg, runs all the way up the outside here and connects into your gluteus maximus. Gluteus maximus, we're told in traditional anatomy, extends the hips and externally rotates the leg. Once again, you don't walk like this. What happens is, when you accept weight, your foot pronates, your ankle does move in, your knee does move in, and the IT band moves across, and the insertion of your glute max up here on the sacrum, coccyx, thoracolumbar fascia of the lower back is actually going the other way, isn't it? Because you're swinging your arms. So the origin of that muscle is going that way, and the insertion of that muscle via the IT band is going the other way. So it needs to function like a rubber band to slow stress down to the knee and to the pelvis and to the lower back. So now we've got flexor hallucis longus, tibialis anterior, IT band and glute max all decelerating the stress as that foot collapses, as the knee moves to the midline, and as the pelvis rotates to help decelerate stress and take pain away from the lower back. If we look at this back leg, what's the muscle that is helping slow me down as I come forward? Those are your hip flexors. So your hip flexors, if we look at the left-hand side, come from the vertebral bodies or the side of the spine, cross the pelvis and insert at the back of the leg. So when I'm walking and that foot pronates, this leg is rotating in. So the insertion of my hip flexors is actually going that way. So it's rotating going that way. The origin of my hip flexors is going that way. So that muscle needs to lengthen as well to decelerate stress to my pelvis, hip and lower back. Because if it doesn't, here's what's going to happen. The origin and insertion is going to come together because they can't lengthen, and I'm going to get stress to my lower back. So that's just some of the muscles that are affected by disruption either at the foot, knee, pelvis, hips, that can cause lower back pain. In the next video we're going to look at some of the anatomy of the upper body and how that can cause lower back pain as well.